Using the allocated support hand, saturate the fingertips with DP Dermaceuticals Hyla Active that has been dispensed into the sterile basic dressing kit tray and applied to the first region to be treated. Simply apply with the fingertips, gently patting and distributing. As each region is successfully completed, more Hyla Active will need to be applied prior to treating each new region to ensure effortless glide. Turn on the microneedling device with the operation hand. As the support hand holds the skin taut, the operation hand should ensure that the microneedle cartridge makes even contact with the skin and is always operated at a 90-degree angle. Gently glide the microneedling device in a confident, sturdy, even, and rhythmical motion. As indicated by the directional chart, procedural technique is defined by stripe-like motions which maintain consistent skin contact. Heavy pressure will create dragging and pulling of the device. Always ensure the microneedle cartridge tip is lifted from the skin between each stripe to avoid any unnecessary trauma. The first stripe should be a vertical movement moving away from the center of the face. The second stripe should be horizontal, moving away from the center of the face. The third stripe should be diagonal. With the exception of the forehead region, diagonal stripes should follow a downward direction working towards the outer facial borders. Always work from the center of the face outwards, away from the eyes and perioral contours. Needle length and oscillation may be adjusted at any point during a microneedling procedure for specialized treatment of different regions or skin concerns. Changes in depth and oscillation should be recorded on the patient's clinical treatment chart as a reference for future treatments. To adjust needle length at any point during the procedure, using the operation hand, simply turn the depth dial at the device's tip. Turn in an anti-clockwise direction to increase needle depth and a clockwise direction to reduce needle depth. To adjust oscillation speed at any point during the procedure, using the operation hand, turn the speed dial at the device's cord end. Turn in an anti-clockwise motion to increase oscillation speed and a clockwise motion to reduce oscillation speed. Once all treatment regions have been successfully treated, turn off the device and place gently onto the sterile field. This concludes the needling component while performing a microneedling procedure. DP Dermaceuticals post-operative protocols following a microneedling procedure ensure client comfort while supporting skin repair, maximizing the infusion of ingredient actives, and reducing heat and erythema. If a DP Dermaceuticals Hyla Active 3D sculptured mask is not being used, follow formal post-operative procedure commencing with a gauze swab soaked in a sodium chloride injection BP 0.9%, which has already been dispensed into the sterile dressing kit. Continue with formal microneedling procedure conclusion protocols. Otherwise, to prepare for mask application, remove sterile surgical gloves and discard. Replace with a fresh pair of non-sterile examination gloves. Open a single-use sachet of DP Dermaceuticals Hyla Active 3D sculptured mask. Unfold the cloth until the mask is completely opened and apply directly over the patient's skin, starting from the forehead. Smooth the mask over the face, removing any air bubbles to form a second skin effect. Continue application to the remainder of the face and neck, ensuring to wrap the fasteners around the patient's ears. To remove the Hyla Active 3D sculptured mask, release the fasteners from the patient's ears, then, starting at the neck, gently roll the mask off in an upward direction until completely removed. Place the used mask in an allocated discard area on the sterile field. Remove any post-treatment secretions, such as blood, with a gauze swab contained in the sterile basic dressing kit. Soak the swab into the sodium chloride injection BP 0.9% dispensed solution and remove any traces of blood or serum from the treated area. Repeat this process with a newly soaked gauze swab until the entire treated area is completely clean. If more gauze swabs are required, 8-ply non-sterile gauze swabs soaked in saline solution will offer additional support. Remove gloves and discard, replacing with a fresh pair of non-sterile examination gloves to commence the clinical procedure conclusion. Dispense 2 pumps of DP Dermaceuticals antioxidant cocktail onto the palm of one hand, then emulsify between the fingertips. Apply directly to the treatment area with gentle pressing movements until the product is fully absorbed. Follow with 2 pumps of DP Dermaceuticals Vitamin-Rich Repair, smoothing lightly onto the skin to restore barrier function and integrity. Conclude the microneedling procedure with a light application of tinted Cover Recover to the treatment area to provide ultraviolet protection as well as coverage to conceal any erythema. Apply in light pressing motions, then blend for a seamless and undetectable finish.